across our border with impunity. We had a completely wide open border and allowed tens of millions of people to enter this country. Cheap labor. That doesn't affect billionaires. I don't think billionaires get replaced by illegals crossing our border, but working Americans do. They see massive wage suppression. And so those are the policies that they've put in place. And they actually shut down the government and wanted, one of the ransom notes was to get rid of the Rural Hospital Opportunity Fund. They wanted to eliminate it. None of them voted for it, and they wanted to eliminate it. Those are just facts. The ranking member talked about the mom with 2 kids. We're the party that cares about the mom with 2 kids. We're the party that gave that mom a $2,000 child tax credit. You voted against that. We gave that mom an $1,800 child tax credit. You voted against that. If that mom worked for tips or overtime, you voted against that. You're the one that wants to give able-bodied adults more money than those kids that mom has. I think a little self-reflection on that should be part of the equation. That those 2 things, just those 2 things, the child tax credit and the daycare credit, is $3,800 for that mom making $25,000 a year. That's real money that you guys did not want to give that mom. That was just your votes, and those are just facts. But when you did have control of Congress and the White House, what did you do? Did you help working Americans? No. You passed a law that gave $7,500 to the wealthiest 0.01% of Amerians to buy to lease luxury electric vehicles. So while the mom with 2 kids is making 25 grand a year struggling, the person making tens of millions of dollars a year could go into a Rolls-Royce dealership and get $7,500 thanks to each and every one of you to lease a Rolls-Royce Spectre. Congratulations on that phenomenal policy. Mr. Schneider, if somebody's in this country without permission, should they be allowed to get health care on the backs of the American taxpayer, yes or no?
My own view is if people need health care, they should receive it.
So you think that somebody who is here illegally should have their health care paid for by the American taxpayer?
So we have a law in this country.
No, I'm just asking you. That's a simple yes or no question. Somebody's in this country.
I agree with
somebody's. Let me just restate it. So
yes, if they need emergency care, yes.
So the taxpayer, the United States of America, should pay for the health care of people who broke into this country illegally.
That's what Congress decided in 1980.
No. Congress never decided. I don't know what Congress you're talking about. If you needed emergency health care and you went to any other country on earth, would you get it for free?
Well, the countries that I've gone to, yes.
You get health care for free if you went into, so for example, let's take Spain, which has incredibly difficult visa standards. If you went to Spain and needed heart surgery, you think the Spanish government would give it to you gratis?
I can't speak to Spain.
But do you think but it's interesting. I wonder if my Democrat colleagues would agree with that.
What happened in this hearing was less about one isolated question and more about a much bigger argument over who government policy is actually supposed to serve: American citizens, taxpayers, or anyone who happens to need assistance. Representative Marino came into the exchange with a very clear argument. His position was that Republicans are often portrayed as the party of billionaires while Democrats claim to represent working-class Americans, but he challenged that entire narrative by pointing to rural America and asking a simple question: if Democratic policies are working so well for working people, why have Democrats struggled so badly with rural voters? And Marino didn't stop there. He went straight after some of the biggest economic issues dividing Washington: manufacturing, trade, immigration, wages, and government spending. His argument was essentially this: for decades, American communities watched manufacturing jobs move overseas, particularly to countries such as China and Mexico, while politicians continued debating the consequences. Marino credited President Donald Trump's tariff policies with attempting to bring manufacturing back to the United States, while accusing Democrats of opposing those policies. Now, whether you agree with that argument or not, there is a legitimate political question underneath it: did decades of globalization actually leave too many American workers behind? That is where this hearing becomes interesting. Because Marino wasn't just talking about factories. He connected the economic debate to immigration. His argument was that an influx of lower-cost labor can put pressure on wages for American workers, particularly workers without advanced qualifications. Democrats and immigration advocates have a very different interpretation of that issue, arguing that immigrants contribute to the economy and that many of the problems facing American workers cannot simply be blamed on immigration. But Marino clearly believes voters in rural America have already made their judgment. Then he shifted to something much more personal, the American family. He brought up a mother earning roughly $25,000 a year with 2 children and argued that Republican-backed tax credits could put thousands of dollars back into that family's pocket. His point was obvious: don't tell struggling Americans that government policy is helping them, show them the money. And then came one of his sharpest attacks. Marino contrasted those benefits with the electric vehicle tax credit, arguing that wealthy Americans could benefit from subsidies for expensive luxury vehicles while low-income families were struggling to pay their everyday bills.
That if people who broke into this country illegally should get health care. Mr. Schneider, if somebody broke into your home, would you make them dinner?
No, I would not.
Why not? Why not? Why wouldn't you? They need help. What if they're starving? What if somebody broke into your home who's hungry? Would you not feed them? Or would you call the police and get the heck out of the house?
If somebody was hungry and needed to be fed, I would feed them.
So if somebody broke into your house, you will feed them. Don't give anybody your address.
So
Whatever you do, I'm asking you just for your own personal sake, do not release your address.
Can I answer the question?
You can, please.
Somebody breaks into my home and they're hungry. I'm going to forgive them for breaking in. I'm going to feed them, and then we'll work out accountability for what they've done.
Okay. Like I said, don't release your address. But on behalf of the American taxpayers, especially the hardworking men and women of this country, no, government benefits, taxpayer dollars should be absolutely and exclusively reserved for American citizens. And so the party that says they care about working Americans, this is why you keep losing in rural America. This is why you guys get wiped out in places like that. Whether it's Virginia or Oregon, you do not win in the rural parts of your state. You get absolutely crushed because of that kind of philosophy.
Senator Merkley would like to make a comment.
Thank you. Just for the record, undocumented individuals are not eligible for Medicaid unless they're in emergency, going to the emergency room under very limited circumstances. And yes, those same services, emergency, are provided.
Marino questioned Mr. Schneider about health care for undocumented immigrants. Marino wanted a yes or no answer. Marino essentially said, let's make this personal. If someone broke into your house, would you feed them? Schneider said that if the person were hungry, he would feed them and then deal with the accountability issue afterward. Marino immediately seized on that answer. His response was basically, if that's your philosophy, you probably shouldn't be giving people your home address. It was a sarcastic moment, but underneath the joke was a serious disagreement about immigration and government responsibility. One side is saying, regardless of immigration status, emergency medical care is a humanitarian necessity. The other side is asking whether American taxpayers should be responsible for providing those services when someone entered the country illegally. And then Senator Murray stepped in with an important clarification. She pointed out that undocumented immigrants are generally not eligible for Medicaid, except under limited circumstances involving emergency medical care. That distinction matters because the political rhetoric surrounding immigration and healthcare can sometimes make it sound as though undocumented immigrants simply have unrestricted access to Medicaid. That's not what was being described here. But Marino wasn't finished. The discussion moved toward California, where the witness, Mr. Blaze, raised another controversial issue: the state's expansion of Medicaid coverage to unauthorized immigrants and the federal funding connected to California's healthcare system. One philosophy says taxpayers should come first, government benefits should be tightly targeted, immigration laws should be enforced, and economic policy should prioritize American workers. The other places greater emphasis on universal access to essential services, humanitarian obligations, and the idea that certain needs, especially emergency healthcare, should not depend entirely on immigration status. They were arguing about what the government owes